now, and I'm going to
It's David and Will. Are there other people too?
it looks like just David.
Okay, great. Okay, we are going to get restarted. This is Senate GovOps again at 3:12-ish. And we have, hi, Will Moran and Dave Englander from the Department of Health. Hi guys, sorry that we kept you waiting. We already got behind on our schedule on our second day. We're gonna get better at it. Just but apologies for getting you behind. And David, I know I have a meeting with you at 4, so we're gonna try to finish on time. As some people know, I'm Senator Ruth Hardy, Chair of GovOps. We're gonna go around quickly. We have 2 people who are gonna join us as we're going. Senator Tanya Bihowski and Senator Allison Clarkson. But
Senator Rebecca White from Windsor County.
Senator Bob Norris Franklin want to include Al Work in Grand Isle County.
And Senator Watson from Washington District.
so we're gonna just turn it over to you guys. We're gonna hold all of our questions until the end so that you can get through, and I'm gonna try to be really strict with that. We'll give you to like 3:34 or something like that. And if you want to just introduce yourselves and tell us a little, tell us about what emergency medical systems does for Department of Health, and anything you have for priorities or for the legislative session.
So I'll just start by saying I'm David Englander. I'm the Senior Policy Advisor to the Commissioner of Health. I also serve as the General Counsel. I'm really here just to answer any questions the community may have that's best directed towards me. But Will Moran, as he'll introduce himself, is the subject matter expert here.
Excellent. Great. Thanks, David. Go ahead, Will.
Yeah, sure. So good afternoon, everyone. My name is Will Moran. I serve as the Emergency Medical Services Chief here at the Department of Health. Just very briefly about me, my entire career has been in emergency services. I served for about 15 years with the City of South Burlington Fire Department as a senior firefighter and paramedic. I moved on from there to manage an ambulance service. And then I've been with the Department of Health for a little more than 2 years as the Emergency Medical Services Chief. So the role of my office is to provide regulatory oversight for the emergency medical services system. Those things that we take a unique interest in include personnel, vehicle, and service licensing. We provide oversight of the education system and improve things such as EMT courses and so on. Much of our work is driven directly by the needs of our stakeholders. You know, we regularly work with folks across the state from both the first responder and the ambulance service licensed services, and interface and look for opportunities to collaborate and to build upon opportunities that exist across the system, both to improve public access, but also to look for efficiencies for those systems to be able to operate. We also work closely with our hospital partners as EMS plays an essential role in facilitating the movement of patients between facilities. So much of our work is about collaboration and looking for opportunities to build upon our EMS system, which ultimately benefits the public and all the folks that serve within it. I'll just highlight that your EMS system is made up of approximately 180 services across the state. We have 91 first response services and 79 ambulance services. We also have 1 air ambulance service that's operated out of the University of Vermont Medical Center. Within our EMS system, there's a little more than 2,900 folks across the community that serve as first responders, emergency medical responders, EMTs, advanced EMTs, and paramedics. On a system-wide basis, our teams during 2022 were activated more than 118,000 times. And those responses can be anything from a person having a heart attack to a motor vehicle crash to a building fire or some other type of support activity for law enforcement. a lot of those numbers also reflect the number of transports that we provide for patients moving within our hospital system. As you folks know, EMS doesn't just operate and provide 911 response. Our emergency medical service providers were a major force in the COVID response. And when we think about all of the avenues in which the general public received vaccination and testing services, EMS was a major player in that realm. The Vermont EMS system was amongst the first in the country to deliver monoclonal antibodies in the field setting. And that's something that I would hang my hat on as a collaborative effort between the Department of Health and Rescue Inc. out of Bennington to bring that essential treatment directly to the home of some individuals who needed that urgent care. So what we see across the system is EMS being very forward-leaning and looking for opportunities to provide not only essential response during those emergency situations, but to also fill in the gaps, right, in our more rural areas of the state where it's difficult to access the primary care system. We know that folks are regularly activating the EMS system to receive the essential care that they need in that moment. That was only exacerbated during the COVID-19 pandemic when folks were hesitant to seek out care at hospitals or their primary care offices because of the concerns about COVID. And therefore they delayed accessing those folks that provide them healthcare services. And ultimately, oftentimes their needs were directed towards EMS because their condition had advanced to the point where they needed emergent interventions. So we're very proud of the work that we do. We work very collaboratively with our EMS partners across the state. I'm proud of the relationships that we've built with folks that just came in the room, Drew Hamilton and Jim Finger. Certainly important partners for us. And, we, just as I'm sure Drew and Jim would say, we look for opportunities to collaborate between the state and our stakeholders. That's sort of a very brief synopsis of the EMS system. I could go on and talk about education for a while, which is an essential service that we also provide some regulatory oversight of, as it is those EMT courses, advanced EMT courses, and other courses that really play such an important role in developing and building out not only those folks that are first entering our workforce, but also for those folks that are looking for professional development opportunities. So we do our very best to make those opportunities available. And I would highlight the success that we've had over the last year when we've utilized more than $500,000 of the EMS Special Fund to offer 4 unique areas of initial and continuing education. We've provided at no cost education for several hundred EMS practitioners. We've provided access to professional development courses such as critical care paramedic and training for our EMS leaders. And that work goes on. And what we've seen is our stakeholders take every opportunity to mobilize those or to utilize those dollars and to provide, at no cost education to those folks. And I'll just close by saying I received a very warm email from Jeff Johansson, who's the service chief at Newport Ambulance last week. And he was thanking my team and I for the work that we had done to make these education dollars available and to provide those courses, those EMS courses at no cost for his staff. And in a few words, he described the fact that for the first time in many years, both of his units were fully staffed. He directly attributed that to the initiative that we've been driving very, very hard for the last 6 months, and that is making all levels of EMS education below paramedic available at no cost. And as I mentioned before, several hundred folks have taken advantage of that opportunity. And I think the number of services that it has touched is greater than 80. So we've seen our stakeholders taking every advantage of that, and we'll continue to look for those opportunities in the future. That's just a very, very brief summary and sort of overview of the EMS system. I'm happy to answer any questions that you folks may have.
Well, Will, thank you so much. That is really good news to hear. And can you just remind me what the source of that funding was for the education?
Yes, so the EMS Special Fund is a $150,000 allocation that comes out of statute that is provided to the statewide EMS system to support things such as education and training all across the state. We take that $150,000 on an annual basis, and we evenly divide that amongst all of the 13 EMS districts, and we make those monies available in the form of a reimbursement for expenses that the districts have incurred when they're providing activities related to education and training.
Okay, so I recall from the end of the last session, my predecessor, Senator White, being very, very adamant about trying to get more funds for EMS, and in the budget agreement that, or the workforce development bill, did you end up being able to access any of those funds? I know we added you EMS as a potential recipient, but it was.
We did.
Were you able to access any of those workforce development funds?
That has not been an area that my team has spent any time on. Yeah, it's something that that would be an area that we would need to take a close look at to see what opportunities exist to make those funds available for EMS services and folks that are looking for a career in EMS.
Okay, because it was funding that was specifically for professional development for healthcare workers, broadly speaking. And at first it was focused on nurses, and then we added other
EMS, and
at the very end we added EMS.
Okay.
So I don't know if you've been able to tap those. There was concern you may not be able to. So I'm wondering if you could check in and see if any of your partners have been able to access that. That would be helpful.
I sure will.
Excellent. And
I thought you said, well, it was 500,000 that you were able to use.
Yes. So specific to that funding program, so what had happened over the last 12 years is that while the annual allocation was $150,000, every year, not every EMS district submitted a grant application to receive their monies. So over the last 12 years, that fund continued to develop a surplus. And where we found ourselves last year was that surplus was approximately $570,000. So our charge by this committee was to essentially mobilize those dollars to provide folks at no cost access to EMS initial and continuing education.
okay, that's excellent to hear. Okay, thank you for that clarification.
Yeah.
Are there any other questions from other senators? Just so you know, I gave my word to my predecessor that when I would look out for EMS just like she did. So know that you have a friend in this committee, and if there are things that we can do to work on your area to make things easier or better, or we will do our best to do so. I can't make any specific promises except for that we will try. So please know that, and also for your local partners. Senator Bielanski has a question.
Yeah, so I appreciate that funds were set aside towards continuing education, but I also wonder about sort of scholarship fund availability for initial EMS training. I know a lot of these jobs are volunteer jobs, and that initial training can be pretty cost prohibitive.
Yeah, so out of the $570,000 that we had to work with last year, we allocated more than that. We allocated more than $400,000 to initial education training programs for folks who want to take an EMR class, an EMT class, or an advanced EMT class. 350,000 of that was put into a voucher program. So every single service had an allocation of $2,083. They could take their $2,083 credit and put it towards sending several folks to an EMR class, They could send 2 people to an EMT class, or based upon the cost of an advanced EMT class, they could probably afford to send, 1 full person and then a partial participant as well. So, and then the second bucket of work that we funded was to target unique areas of the state that we identified as being underserved in EMS education, right? So what we're saying is, because of whatever factors, most often it's related to geography, they just didn't have community-based EMT courses. So we partnered with some EMS educators around the state to target 4 unique regions of the state and provide at no cost EMT education in those areas. So there has been more than $400,000 allocated for initial EMT education.
Excellent.
And I think there was scholarship money also additional to workforce development bill.
Yeah, there was something in the workforce development bill, I was
I'm
just
just looking
not
at that.
sure if you accessed it. So if you have additional information you can provide on that, you can send it to Olivia, our committee assistant, and she can share it with us.
Okay.
That would be great. And just in the meantime, we are gonna probably, the legislature more broadly is interested in talking about dispatch and working on that system. And I know that you're part of that. So we'll certainly have you back in to talk about that with us, if not other things. And we know that the governor's budget is not out yet, but when it is, if there are things that are relevant to you, we'd love to have you come back and talk with us as well.
Would certainly welcome the opportunity.
Well, thank you, Will. It's really nice to meet you. And thank you, David, as well. I'll see you later. And
Oh, David's there.
Yeah.
Hi, David.
thank you so much. Take care.
Thank you. Take care.
Thanks very much.
Oh, and Drew, your timing was amazing.
You guys walked in at the right time. We are now back on schedule. The EMS presentation was great. So what?
They're fast.
They're fast. Those are
Hey,
That's right.
time is survival. Time is health.
Yes. So you guys are our last 2 for the afternoon.
So you want us to be really fast?
Well, no, we have until 4. I have a hard stop at 4. So you have a half an hour, which is what we allotted you because they were fast. So if you want to come up to the table, we'll introduce ourselves and then
Sure.
you can
Let's sit
introduce.
together separately?
How it's your show, so whatever you want to do, you can pull up 2 chairs or you can take turns, whatever you want to do.
That's fine, we'll just, I'll hold your over next.
We'll work pretty good
together.
Thank you.
Believe it or not, we do this a lot.
I'm sure you do, you're pros. Well, thank you so much for coming by and just meeting the committee. We are all new except for Senator Clarkson, who you know, I'm sure. And so we are hearing from as many organizations, people, offices, departments, agencies, et cetera, that we can to just sort of get a lay of the land. And so we'll just turn it over to you, but we're just gonna go around and introduce ourselves so you know who you're talking to first. So I'm Senator Ruth Hardy from the Addison District and the new chair of the committee.
Senator Tanya Vyhovsky, Vice Chair of the committee, and I'm from the Chittenden Central District.
Senator Rebecca White, and I'm from Windsor.
Senator Bob Norris, Franklin County, to include Alberg of Brandale County.
Senator Ann Watson from the Washington District, which is Washington County, Still Orange, and Braintree.
So it sounds like, a house route. They were just all their names. Allison Clarkson, Windsor District. And yeah, I can't wait for an update on some of this. I'm a little concerned about that workforce development money. And I'm looking it up in the bill because we mentioned you guys in lots of places.
Yeah, you'll have to update us on that. So go ahead.
Jim. Well, we can go over a lot. We've been working for quite many years, especially with yourself.
Yeah.
Sorry, I'm Jim Finger. I'm the president of the Vermont Ambulance Association. And we've been working quite a few years together and working towards a lot of development.
I'm going to interrupt you already because I failed to do this. And I would like Olivia to introduce herself as well.
Olivia Parker, I'm the committee assistant. My face, sorry.
Go ahead, Jim.
Nice to meet everybody. We, like I said, been coming for years. We could tell you about that funding. We tried to put funding in every year because we knew the system was falling apart and going downhill in training. But they kept coming back to that special fund. And that special fund, as Will said, kept growing with a side pot. But the state wouldn't let us use it because the legislation actually said it would go 9,000 to each district. But there was a bunch of districts that didn't take it. We finally got that spent this year, but it proves, and as we go through, that we need the funding because our manpower is very low everywhere. That's just a start, but want to make sure you understood that. We kept coming back, and then they would get to the budget committee or whatever, and they'd say appropriations, but there's money there, but we couldn't access it. Now we finally proved that we can use it, and it's making a difference. That's our number one thing.
So Drew Hazelton. So I'm the Vice President of the Vermont Ambulance Association. I also chair your EMS Advisory Committee, which just came from our advisory meeting. We are a little late on our legislative report that is due to you, but I expect you'll have it. I'm sure you have plenty of other ones to read.
Yep.
So we'll be getting that to you hopefully in the next week or so. As Jim said, we've spent a lot of time in this committee room. It's always been a friendly committee to us, discussing really what the challenges are facing EMS. And the reality right now is our focus is funding workforce development. I think you're going to hear that pretty much across the board. EMS was struggling prior to the pandemic, and it has certainly not made the situation better for us as far as workforce development and long-term funding. As Jim said, we don't have a large amount of sustainable education funding in Vermont. The total education funding is at $150,000, which really does not go far when it comes to standing up and supporting the EMS system. We see about a 30% workforce turnover every single year, and our need to kind of keep bringing people in and bringing them through is something that we spend a lot of time looking at. We're also actively looking at ways to retain EMS providers. So at some point, I'd love to come back and explain our legislative report and kind of the detail that and the work we've put into that. But some of the challenges EMS faces are that reimbursement for EMS is quite often expected to be through insurance payments, and our insurance reimbursements reimburse less than the cost of delivering services. We haven't seen a significant increase in many years, to the point where EMS services are struggling to pay appropriate wages, benefits, and cover their operating costs. And what that's translating into right now is many services having going back to municipal budgets and looking for significant increases. And I put that out there simply because every time we do that, every time we force EMS providers to hit the property tax, we're losing our federal match on Medicaid money. We're forfeiting all of that return.
So just to clarify, it's Medicaid that is the problem, not Medicare reimbursement.
They're both the problem.
They're both.
Unfortunately, you guys don't get to control Medicare.
We only get to control Medicaid.
You-
But how is Medicare in their reimbursement? Because you have a lot of older patients that you transfer.
Yeah, so Medicare's reimbursement, so right now, Medicaid of Vermont pays 71% of what Medicare pays. Medicare was intended to pay 80% of the cost to deliver services. This is a typical federal program. We want you to deliver it at 80% of what it costs you. And then Medicaid in Vermont pays 71% of that number. And as part of our report, I have all those details.
Okay,
I'll make sure you have all of that.
Excellent. Senator Bienkowski.
I can wait for the report. I was just going to ask if you had numbers around the private insurers reimbursement rates as well, because I imagine those are also not right.
Well,
They're
so
better than
they're
Medicare.
better than Medicare. One of the challenges, and as we kind of go through the session and we can talk about some of the things that we see and that we're feeling like are going to be challenged. There's federal legislation that is likely to create challenges with the private insurance reimbursements that we get. And if that balanced billing legislation happens, it will have a negative effect on the revenue streams of ambulance services in Vermont. But again, that's kind of an in-depth explanation and we can provide that kind of explanation more as we go through. So even, Will talked about some success, and we worked with this committee to develop a new program, Vermont First Responder. We worked with this committee to come up with and institute changes in our education system, and we've been very successful at kind of recruiting. And as Will said, we were able to get a fair amount of new people in the seats. Our overall number of EMTs and advanced EMTs serving right now is less than it was 2 years ago.
It
So
still is, even with all that additional.
even with all of the additional work, we're not quite treading water. We're seeing, a request volume, the request for services increasing year over year, and the total resource we have to deliver those services has continued to drop over the last 5 to 10 years. To complicate that, our hospital partners are seeing the same workforce challenges that we're seeing, which has forced them in a lot of cases to close hospital spaces, shut down hospital units. And what that ripple effect does to the EMS system is it requires us to move patients from our local community hospitals further to definitive care. And so in our area, I work out of the Brattleboro area, and we're having to take patients all the way to Southern Connecticut to get them treatment for cardiac and stroke care because there's no hospitals closer. At our advisory meeting, we heard from Newport, Vermont, who has actually had to go to Southern Connecticut from Newport because they're the closest available hospital that would accept their stroke patients and cardiac patients. We're having to go to Albany, and when we get to Albany, our ambulance crews are spending 2 hours waiting in line in order to get into these hospitals to turn these patients over.
And this is because the hospitals don't have the staff to provide the services, or?
So this healthcare, because this ripple effect through the healthcare system has had a huge impact on EMS. The other area we're seeing that is try to get an appointment to see your doctor. Primary care is struggling in Vermont. I have one patient in our area that has called an ambulance 338 times in the last 12 months. And we're struggling to get that patient along with other patients care, placement, and treatment because our healthcare system really doesn't support that. And EMS is the safety net. Universally, you call 911 24 hours a day. Ambulance service providers, first responders will show up. And again, I'm just going to give you the highlight of what we're going to provide you in our report. It's a struggle. Our staffing is, as we said, not keeping up with our call volume. Our reimbursements are not covering our costs because of the hospital staffing shortages. The hospitals are utilizing EMS providers in their emergency departments as ED techs. Hospitals are pulling from the staff that we've worked so hard to try to build to sustain our system, and they're able to pay at a rate that we can't because of the way we're reimbursed. We've seen a 25% increase in labor costs in the last 12 months. We have not seen a change in our Medicaid rates since 2019. Say nothing about vehicle costs, supply costs, and health insurance. So that's kind of the good, like we're doing some good stuff, and we do have some challenges. And then the dispatching one, good luck with that. I spent all summer on the dispatch committee. I wish you the absolute best at solving that quagmire.
Did your committee come up with a report? I think that's what we're going to be dealing with.
Yes, and I'll give you the preview. It doesn't give you a solution.
No, that's what I heard. Yeah.
Yeah,
Is it out yet? It is?
it should be out. You guys should have that.
I think we'll do the 15th.
Yeah, so, and dispatching is challenging because one of the solutions, or one of the proposals involves charging EMS services for dispatching. So we already have a failing system that doesn't have enough financial resources to support itself. And now we're going to start adding additional financial burden by asking them to pay for their own dispatching services. So it's,
Forgot that.
good luck.
Okay, thank you. Senator Bielski.
So correct me if I'm wrong, but I have sat through some of the municipal meetings with Essex Rescue, who has, yes, there you go.
I saw their rating.
Well, and you're providing a critical service, but yet aren't under the federal umbrella of the Emergency Services Fund. is my understanding, and so don't have access to that sort of federal money that police and firefighters do. Or the Essential Service Fund, that's what so my understanding is you're not classified federally as an essential service, and so therefore don't have access to some of that federal money. Is that true?
So we are not considered an essential service. So EMS, a lot of the federal programs, for example, the grant programs that are out right now, 98% of those funds are allotted to fire service. 2% of those are allowed for EMS. So there is a very much a lopsided federal funding. 85% of the emergency calls are EMS, 15% are fire.
So you have an embedded person now at the Wyndham County senator I know who's now in Congress who can hopefully introduce a bill to change that.
I would expect nothing less.
I would, but you need to be asked.
Well, and that's kind of getting to the point is how can we partner with you to partner with our federal delegation to try and bring more federal money into what I would argue is a pretty essential service.
Yeah, it's essential.
So one of the things that's going on, sorry to interrupt you, Jim. So cost data reporting. So the federal government, with support of our National Association and our stakeholders, wanted to look at what does it cost to deliver ambulance service across the country. And that project kicked off just before COVID. Unfortunately, that project was suspended because of the pandemic. And we're just now having services report cost data reporting system, which means we're not going to see the results of that for several more years. So the legislation, kind of the federal process for increasing the way that EMS gets paid is in the works. It was 2 years delayed, which is holding us sort of hostage to an old system. Another kind of bonus from our pandemic. We're hopeful that the data that we'll provide will show that the cost of delivering service in 2023 is very different than it was in 2000 when they created the system.
In other states, EMS or ambulance and fire are combined into one department, local department. So I literally grew up across the street from a fire department that had, ambulances and 2 bays and fire trucks and 4 bays. Why is that not usually the case in Vermont?
So in many areas of Vermont, first response, so your local first response is based out of your volunteer fire departments. That being said, EMS across Vermont varies a lot. If you've seen one EMS, you've only seen one.
Is it maybe just only in my county that it's not combined?
In many counties in Vermont, actually there's only 8 places in Vermont that fire and EMS are operating at the same place. Because Vermont doesn't have a lot of career fire service. It is the most.
We combine them.
You combine them. Yeah.
I
there's
say a
8
lot of Chittenden County does.
Chittenden County. So there's 8 of them. And that requires a significant municipal investment.
Yeah.
So if the municipality wants to fund that, then certainly they could have that level of service. Most of the municipalities that we're talking about don't have the financial means to fund a career fire service, and those fire services are volunteer.
Okay. So do you have? Just hold on just a second.
Okay.
Do you have more that you want to tell us? Okay. And did you want to add anything?
Other than that, when you want to talk federal, I deal with that all the time after 30 years. Going down and meet Senator Leahy, Sanders, Welsh. It's a very complicated, it's not easy to fix in any means. And it takes many, many years. We have a very good delegation when you said to ask what they do. They have supported and put forward bills and been the major sponsors. But it's a whole country. And if you've seen one ambulance services, we said, you've seen one. Vermont is no different than any other state that has problems. These manpower problems are in every other state. We're just, where we do see is things like, we could get into later, but like Medicaid rates that we get paid for that you do have control over. Some states pay more than Medicare, and that helps. When it comes to the training funds, those are the things that we've finally proven because we've used that money, all those things. But one thing that when you get the report, there's a word in there this time that they put in the first sentence, that we're now at a crisis point. When you see the manpower numbers and they've been going with the COVID affecting us, you would see that our manpower numbers are down and we're already were before the problem. So that's why we're stressing. I don't want you to get too confused with the federal. It's very difficult there too.
Yeah, absolutely.
And we
And,
gotta
and
wait
as
till-
you know, we are not the money committee, so we can't tread too deeply into the funding parts, or our colleagues next door will get a little peeved at us. But it is good to understand the landscape for sure. Medicaid reimbursement rates are a constant conversation in my other committees. So, are there other questions? Senator Clarkson?
Well,
did you have-
actually, when we unleashed Senator White on the Appropriations Committee, we got everything we wanted. So and we can be really strong advocates for that. And the Medicaid, I mean, you're not sadly the only service, medical service, where the Medicaid reimbursement and rates are appalling. So I think we as a legislature need to really fight the bullet on
So
this.
there was the global commitment waiver for Medicaid was just renegotiated. Were there any changes to in the ambulance service part of it?
No.
No. Okay.
We don't, well, one question is they're saying they're at their limit, it got increased. But we don't know how if they increase ours, does that affect that limit when we match federal? Or is it at that limit? That's a question I thought I wanted to ask.
Yeah, I think we have a lot more flexibility this time around, so it'll be interesting to see what happens in the governor's budget proposal and if there are changes in Medicaid reimbursements or not. Another question I had is about, ambulance services response in a crisis related to an opioid or any kind of drug overdose, and what you're seeing in the field and what kind of assistance or ideas you have to help address that problem.
So mental health and substance abuse is a huge problem in Vermont. I think everybody knows that. We have been seeing a steady increase in the number of drug overdose, substance abuse type calls that we've been seeing. Probably the steady increase goes back 4 or 5 years.
Yeah.
What we see a lot are patients that are repeat patients. Let me tell you a quick story to kind of describe it. There's one young lady, and you may have heard the story last year. There's one young lady that we did CPR on and Narcan 4 times in the course of a couple months. And every single time we transported the patient to the hospital, after resuscitation, we explained that we're gonna get her the help she needs. We get her to the hospital. Whatever happens after that ER, the help she needs wasn't there. So 4 times, 3 times, 4 times, the 5th time we arrived, she was deceased. And that story is extreme, but it's not uncommon for us to resuscitate the same person 2 or 3 times over a period of months. And I do wonder, what is backing up our promise when we take care of these patients for medical care? Because I'm feeling like, and our crews are getting the feeling like there's really nothing, like they're empty promises that we're making them, that we're getting them help, because they don't seem to be getting help because they keep coming back into our world.
So that is a terribly sad and tragic story, and thank you for sharing that. I'm on the opioid settlement advisory committee, and that's what my 4 o'clock meeting is about. So do you, in the communities across the state that your people work in, are there any areas where you're seeing that there is that backup, that people are getting the help they need? And if so, what is it? And if not, what are you seeing? Do you have ideas about what she would have needed to be able to not have to come back, have you come back?
Serious programming that's sustained.
So I don't know. So I haven't done that research across the state. In our conversations, I don't I haven't heard anybody that says they're having a good time with it. So like nobody's started out like, hey, we got a
No best
solution.
practices out there, Tim?
And as far as services, one of the things that we've noticed, even so, the emergency department is not a place to treat mental health issues. It is quite often a boarding location. And as we move patients into that environment, and there is no available treatment, they end up signing out AMA because they don't know when they're going to be able to go to treatment. It could be today, it could be tomorrow. In some cases, we're seeing 13, 14 days where they're being housed in emergency departments because there's no actual placement for them.
Do you ever transport people to any kind of other drug rehab program type, community or peer-based programs that are not the ED?
So EMS can't do that. So
Okay.
Currently, though there are some federal initiatives that would allow kind of some alternative destinations. Currently, EMS can only transport to an emergency department.
Okay, so you couldn't take somebody to an appointment or to a alternative peer-based program or something, or a living room type program, which is.
Not under the current kind of 911 system. There are some other outlying things that can be arranged by a physician or through medical orders. But if they call 911, then they'll end up at an emergency room.
But you do transport, I see, I'm sorry. You do transport patients from hospital to hospital, like who are
Absolutely.
being transported for medical reasons, but that, even if it's not ED to ED or.
Yes,
Okay.
but there has to be there's a legal requirement for medical necessity. So
Yeah.
we have to make sure they fit a certain criteria in order to actually be able to take them by ambulance for that. And a lot of times our mental health patients don't meet that requirement because they don't really have a medical supervision need. Sometimes they meet that criteria if they're a risk to themselves, and that's determined by the healthcare workers at the sending facility. But if they don't meet that definition, then they wouldn't be eligible for ambulance transport.
Regardless, I would just add that that's where we started with. The problem is today, less people, more transfers. They want us to do more. We don't have the staff. You
Yeah.
heard from Newport, God bless them. That's all I can
Yeah.
say.
Yeah.
The rest of the state's still having troubles.
And do you have people who are first responders with ambulance systems that are social workers or any other staff that might be able to be the next step for helping people, or is that not even possible given the crisis you're in?
That's a great question. So the answer is there are places around the country that are beginning to operate what's called mobile integrated healthcare, where EMS, mobile integrated healthcare.
Mobile aid.
Integrated.
Oh, integrated.
And a mobile integrated healthcare program does allow for alternative treatment plans, which in many cases would get patients to destinations or therapies or telehealth alternative to the emergency department. There are some challenges in Vermont to standing up those programs. Starting at a program down in our area with our local hospital.
Where are you?
Down in the Brattleboro area.
Brattleboro, okay.
So we're working with Brattleboro Memorial, and we'll be working on a program with them as a statewide pilot project but it's not really ready for kind of public consumption yet.
Yep.
Because I think that is.
Don't worry, you're only live on YouTube.
That's why I'm trying to be a little bit careful that I don't make my partners that during this discussion go, what did she say? We're not ready yet. So there are models that we could and should look at.
Okay.
We are also working with the Brattleboro Retreat to help them facilitate transportation for patients that are not medically necessary but need transportation. There's a category of patients that fall in like this gray area. They can't get to the facility that they need to get to for treatment on their own, but they don't meet the definitions. So as they said at EMS, we're trying to figure out how to work through the rules and.
Okay. If you have anything on the mobile integrated healthcare or your proposal down in Brattleboro that you would be able to share with me, that would be helpful. Senator Vihoski.
Absolutely, thank you. So my questions are kind of in line. I'm a social worker by trade, so this probably won't surprise you. But I first and foremost wondering if you feel like the training as it stands now includes adequate trauma-informed support around mental health and substance use for your
Absolutely not. I will tell you that we have partnered with a group. So starting actually in the month of January, all EMS programs that we're running out of our academy in Southern Vermont will have that as part of their initial education. And we're offering, actually the EMS office through the voucher program is offering the first one-day seminars for resiliency and mental health for providers. And that's coming up in February. So it is certainly something we're working towards, but we're nowhere near there.
And then my next question, we talked a lot about this in the last session, is just like that takes a toll on you when you've gone to someone 4 times and then the 5th time they are deceased because the services don't support. So do you feel like you have the supports you need for your own mental health as a profession to remain okay? I mean, that's vicarious trauma.
Yeah, that's an easy one. No.
I sort of anticipated that
So-
those were the answers, but I didn't want to assume.
It's very challenging a lot of our EMS system is extremely rural. They have very little support. So we've been working on this kind of first responder mental health issue for quite a few years.
Yeah.
And in
Since
large
this
areas.
is 2020.
Yeah, so it's been a while. And there are some areas that are getting better. So the state police now has access to, mental health services for their personnel. But to kind of reach to those small first response squads that are in Alberg, there's no services available to them.
We did create, you referred to it, a task force with, I think, 27 people on it. We went through the whole alphabet and then started over again. I remember that.
Yep.
You must have a representative on that. And
I do.
Are you it?
I am not it. I have actually our director of human resources sits on that.
Uh-huh.
We actually were reviewing their report earlier today.
Uh-huh.
And it's very much in line with what we expected it to be,
Mhm.
which is that the services that we need are not currently available, but we certainly need to work towards that.
Yep.
And we do reference that in our legislative report. The work that they did certainly represents the feeling of the EMS community.
Well, one
Question?
last
Yeah.
one, go.
So the other piece that I'm hearing a lot about particularly from emergency department staff, is an increase in violence and an increase in assaults. And I imagine you are seeing that with your staff as well. And I'm curious to know if you have the solution
You mean directed at them or
Yes.
responding to domestic assault?
directed at them.
I don't have the solution, but what I will say is, and it happened actually in Brattleboro, it was in the newspaper yesterday or today. The people that are being violent towards and assaulting healthcare workers are not being held accountable. And it was opening the newspaper and seeing that a person that has assaulted not only my staff, but the ER staff, to the point where we have physicians that have been out of work for months due to the violence of the assault, were released on conditions they not do it again. Even though this has happened to our staff by this one individual, like we're talking multiple assaults. I guess from me personally, like there needs to be some sort of accountability, because that person now is back in the community. And remember, when they dial 911, we still have to respond. And law enforcement doesn't respond with us anymore. That also changed last year. So most of the time, we are trying to navigate these potentially violent mental health scenes without the support of law enforcement.
So at some point, when you come back with your report, I
Yeah.
think we'd love to hear how
Yeah,
that got
well-
decoupled.
We'll have you back to go through your report with us. I'm sorry, it's on me. I have a meeting that I have to be at. And, but thank you so much for coming in and talking with us and introducing yourself and meeting the committee. And we'll have you back for sure. And next time come with answers. No,
We actually expect you to have the solution, to be clear.
I'm just kidding. I'm just kidding. Well, no, I'm not kidding, but I also understand why they're complicated problems.
And you can now appreciate why we
Yeah.
focus so much on this,
Yeah.
because this is an essential service that has been under cared for by us, by the legislature in particular.
Pleasure meeting you all.
We have a lot more information. I just didn't want to get into like little details. So as we come back, I think we can
Great.
just help you guys understand.
Yeah, absolutely. That's great. Thank you both.